Hi, welcome to Learn and Go with Laurie. Today I want to introduce you to Caroline. This is Caroline on her 11th birthday. She's a Swiss mountain dog. She came to us lame on her right front leg. You say, how do you know that? Well, if you look at her, when she walks, she puts her head down when she's on her left front leg and up when she's on her right front leg. So that tells us her right front leg is what's bothering her. But there's more to it than that. What I want you to see is that she's putting enough weight on her right front leg that her metacarpal pads are on the ground. Also, when we look at her whole body, she has her front feet pretty close together or square underneath her, and yet her back feet are further apart. If you look up close at her back feet, you'll see that she has weight on the inside of her rear feet with her toes already bending outward, telling us that she has abnormal weight bearing in there. When we look at her body, she doesn't have the typical pulling weight off of the front that we see when we just have a front end issue. She has her back feet underneath her and wide and rotated in, so that tells us there's probably something going on with the back end, which we found. And then secondary to that, I don't know where to place my weight, she had back pain. Makes sense, right? As we look at this, I want you to see a month later, she's significantly more lame. Her head bob is much more pronounced. The crazy thing about this is she was this sore in the morning, but by afternoon she was barely lame at all. We'll talk more about that in another video. But I wanted you to learn a little bit about lameness today. I hope you had fun. I hope you learned something. I'm Laurie McCauley, and thank you for coming to Learn and Go with Laurie. We'll see you again soon.